every patient that comes into the clinic, I'm not sure if you're noticing it as well, but there's an underlying level of stress, and there's because of the stress they're experiencing, their pain is more extreme, their digestion issues are more extreme, their sleep issues are more extreme. And so we're always having a conversation every time the patient comes in regarding stress. And I always make it a point to let them know that I am so glad you're here. We're going to take care of your chief complaint today. We are going to be balancing your immune system, and that was our subject last month. And we're going to help you resolve your stress. So I always put together a package deal. A package conversation, an introduction. I help them know that whole, that they're getting the whole deal when they come in for acupuncture. And because I want to educate my patients that we are more than just pain, and we are more than just infertility, and we're more than whatever their chief complaint is, we're more than that. And so it's our job to teach them this. And AcuGraph is a fabulous way to do that, but I just want to encourage you just to use your words. Plant that intention in their minds and in their hearts, because it trickles. When you have that intention set for yourself, it trickles out to your patient, and it trickles out into the world. It trickles out into whoever they come in contact with. So, in fact, the other day, now that my new clinic is right next door to Meridia Technology, I had to run over here for something, and I was talking to Jenny, and I saw all of our little stickers in the back that say acupuncture makes you happy. And I said, Jenny, I'm going to take a dozen of these stickers today. And I wore a sticker all day long, and I made sure everybody, I must have taken more than a dozen, because I made sure that everybody who left the clinic throughout the day wore a sticker when they left, because I want them to know acupuncture can make you happy. And it's fabulous when we can watch the emotions change, feel them, and watch the monograph. And that's kind of what we're going to talk about today. So I would like to encourage you, if you've come today with any questions that are beyond stress and anxiety, I hope that you will post those questions in the chat window so that we can come back to them. These Hangouts are supposed to be a place where you can come because you have questions, where we can come and share ideas, and then also where we can do a little bit of teaching. So
it's interactive. That's the cool
right.
thing about this platform. So you're going to present, but we can interact with you. So interact, everybody.
Please do. All right. I think that you will have to give me the opportunity to share the screen. Let's see. Nope, you've already done it. All right. So today's presentation, I've kind of taken a little bit of a different approach today, and I'm teaching you, one, I'm teaching you how I talk to my patients. Two, I'm teaching you how to look at the graph and analyze it from a quick perspective. Just look at it and say, oh, I think maybe this is going on. So a way to introduce you when you're looking at the graph to ask questions to your patients. But then I'm taking you a little bit deeper into how my brain works when I'm not sitting in front of the patient, and how I pick things apart and come up with different ideas and strategies based on looking at the graph. And then I'm going to give you some treatment, some ideas that perhaps you could add to what you're already doing. So, using Chinese medicine to help stress and anxiety. Let's see. There we go. There we go. So today's goal is to educate you so you can educate your patients. And we're kind of on a series right now of multiple topics. So make sure you schedule out and watch for the upcoming series in the upcoming Hangouts in this series, because it is about educating you. So first we'll talk about graph analysis. So for anxiety and stress, if I were going to teach you the simplest thing, you're a brand new AcuGraph user, you kind of want to be able to look at the graph and say, oh, I noticed something is going on, and then be able to ask your patients questions. So I gave 2 examples here of the pericardium and the heart. When I see excess in the pericardium and heart, I tend to ask my questions. Hey, what's going on? Have you been anxious? Have you had a lot of anxiety? Any palpitations? And this has come through years of graphing patients. I think I've been graphing patients for, I don't know, 12 years now. I just happened to notice that when the heart and pericardium channels are excess, that there's been a lot of anxiety. And so when I look at the graph and I ask them that question, they're like, I knew you would know, or how did you know that? So it's just a way to begin the questioning. And if you only know that much, just to be able to ask the question, then you've opened a door where your patients will tell you more, and that will give you more information so that you can dig further. On the other hand, if I notice a patient that if I see both the pericardium and the heart are deficient, I kind of look at them and I say, tell me about your anxiety levels. Do you have a tendency towards anxiety? Maybe you're not in a panic mode right now and you're just kind of surviving, but is there a tendency towards anxiety? And then we get a conversation going that direction. The key with AcuGraph, yes, you can measure and you can watch progress, but if your eyes begin to notice information in the graph, it opens the avenue to a conversation. So we're going to dig a little deeper here. Clearly, okay.
One question, Kimberly. Maybe
yes.
I'm jumping the gun, and if so, then just tell me to wait. But with pericardium and heart, you talked about them working kind of together, both excess or both deficient. Do you assign any significance or ask any questions when you have maybe pericardium excess and heart deficient, or vice versa in that pair?
Just general questions on anxiety. The pericardium and heart always tie me back to anxiety to begin with. It's not usually a musculoskeletal symptom that I recognize in pericardium and heart. Although if you recognize that the heart and the small intestine work together in pairs, then I tend to then also look at the tension that's going on in the back. So anything that I see pericardium and heart, I just begin the conversation about anxiety, whether you've been in a panic attack mode now or you have a tendency. And those 2 are important because it helps me over time as I go through a patient series. It helps me to untie the underlying patterns, perhaps based on their lifestyle, based on the long-term situation going on within their body.
Okay, cool. Thank you.
So again, this is my simple analysis. I'm going to get a little bit deeper as we go further, but it's important as you go through your years of AcuGraph. If you have enough to have a simple analysis, it at least gets you going and helps you to begin asking questions, and you can always dig deeper. There's so much you can learn as you go through the years with AcuGraph. A little thing will show up and it'll make you think on a much deeper level. So again, simple analysis here. We're going to move on. So this was pericardium and heart. We are going to move on to this. So anxiety was pericardium and heart. Stress and irritability is the liver. And we all know that, liver qi stagnation, that's something we all learned in school, no matter where we went to school. So when there's excess in the liver channel, I'll ask if they've been irritable, if they've been angry, have they had any headaches, any eye twitching. I ask the typical liver qi stagnation questions. If I see a deficiency in the liver, that can be a lot of different things. It can go hand in hand with yin deficiency, with the kidney, but just in relation to the liver. And maybe they're a new patient and I see a deficiency in the liver, do you have a tendency towards irritability? Irritability is different than angry, you know, red excess, angry rage. Irritability, you know, that's underlying heat that kind of smolders and you just feel cranky and irritable. So those are just opening questions. And based on what I'm looking at, I ask questions. This is a fun one that I just kind of threw out there because this is a real graph of a patient of mine. So here's probably a first patient. So pericardium and heart are excess and the liver is excess. And there's a whole lot of other things you could look at and talk about on this, but these, just looking at the graph, I start saying, hey, tell me about your anxiety levels. Tell me about your shoulder tension, because I'm noticing the small intestine and the triple energizer excess. Tell me about your irritability. Do you have back pain? Do you have weak digestion? The deficiency in the bladder gets me asking about back pain. The digestion, the spleen and stomach are low. So just looking at a general graph, it just gets me asking questions. And that's what I want. I hope over time, as you begin to learn graph analysis and have your own case studies and come to events like this, that it just, I'm trying to get you to recognize questions you can ask. So now, this is the fun part. We're gonna dig deeper into a TCM analysis. And I don't always do that when we do these Hangouts, but this was a really interesting subject. And because anxiety is such a prevalent concern right now, and as acupuncturists, we wanna be really good at treating it. And so here's where we're gonna dig deeper. So we're going to talk about the pericardium and the heart together. And the heart, the pericardium is the protector of the heart. So it's, when you look in the any of the TCM books, Practical Dictionary of Chinese Medicine, you read about the pericardium, you read about the heart. And so in the classic textbooks, they'll talk about the heart, the pericardium that protects the heart. You have to get through the pericardium first before you can get to the heart. So that's kind of a fun little question patients will ask. Well, so what does this pericardium do? Oh, it's protecting your emotions. It's protecting your anxiety. So it's protecting your heart. So it's just simple conversation, but a deeper understanding. And when the pericardium and heart are balanced, then from a classical point of view, the blood and qi are abundant and the mind is clear and alert and energy is moving. So, and it's moving smoothly. It's moving through the body the way it needs to. So again, balance is abundance. And when that happens, then we feel clear and alert. Notice that when we're imbalanced, that's when we're annoyed, we're frustrated, we're worried, palpitations, anxiety, poor sleep, vivid dreams. So what we're trying to create for our patient is balance. And so when we're looking at the pericardium and heart, that is a consideration. So the goal is circulation, and AcuGraph is the perfect analysis to explain. I like to show, let me just share a screen here. Let me just find an AcuGraph. Let's go with patient series. There's a series. So let's go older. Okay, here's an AcuGraph. So patient comes in and there's a lot of stagnation and energy is not flowing through the body the way we want it to. If I click on energy cycle, this is kind of, if you were going to start with a first pathway and move to the end, we start from the lung and we move to the large intestine and then to the stomach, and then notice spleen, heart, small intestine, bladder are all blocked and the kidney is deficient. I give a really simple analysis about the acupuncture pathways are like a roadmap through the body, and traffic needs to be clear and energy needs to be flowing where it needs to go. And so we might start out by looking at the baseline graph, but when I change them to energy cycle, we want it to flow smoothly from pathway to pathway. So in this particular graph, energy stuck in the lung and not moving to the large intestine. So if wherever energy's stuck and it's not moving forward, we go back to this goal of circulation, free flow of energy and consistency. And if you look in this graph, it's not consistent, right? Energy's stuck in one area, not moving to the next area. And so that is the goal. We want consistency. When energy isn't consistent and it's not flowing the way it needs to, when there's excess in a pathway, there's a tendency, and this is where I'm going to bring TCM patterns in, there's a tendency towards stagnation, and stagnation leads to fire. So think about it. When energy is stuck, I'm going to bring this graph back here. I don't have a specific anxiety example graph, but I guess this kind of fits because the heart channel is excess. So the stagnation that sits here in the spleen, the heart, the small intestine, and bladder, if it sits there for too long, then the next pattern that it evolves into is fire. So you can think of excess in that way. Stagnation, it starts as stagnation, and if it sits too long, stagnation turns into fire, and it keeps going from there and gets worse. As far as deficiency, when there's deficiency and energy is not flowing the way it needs to, we're thinking of qi deficiency, blood deficiency, even some yin deficiency. I do sometimes see excess with yin deficiency because yin deficiency is a heat, and so that's a way to pick it apart a little deeper. But just think of deficiency in general, a tendency towards deficiency. So, and we're going to dig into those patterns a little more as I talk about treatment strategies. But for right now, what I want you to recognize is if you balance the graph, if you treat the points to balance the graph, 80% of your work is done here. If you, you can choose any way you want. You could choose the baseline treatment or the element treatment, whatever, excuse me, the 6 treatments in the bottom left-hand corner of your screen. I'll bring my graph back over here. Right down here in these treatments, you could choose any of these treatments, and we talk about different reasons and why you would treat them, but any of those will balance the graph. And that's where, again, 80% of your work is done. And what makes you a really fabulous practitioner, you've got to get the 80% done, but then you've got to have tricks and tools and techniques for the other 20%, and I'm going to talk about that. My favorite treatment strategies in the left-hand corner are basic, back shu, and divergent. So I use them all for different times and different purposes. So the next thing that you want to do after you have balanced your graph, you want to treat the symptoms. And so one way that you can do that, I'm going to show you in your AcuGraph. So let's just say I chose to do the back shu points to balance. No, let's say I chose, yeah, let's do back shu. So I'm going to add those points to the treatment plan. Those are in. Now that's going to balance the body. And then let's move on to the reference section. If I go to the reference section and I click on conditions and I type in the word, any of these words, palpitation, anxiety, irritability, insomnia, dreams, what symptoms is your patient experiencing that they want to overcome today? So I'm going to type in anxiety. So I can come up with protocols, primary points for anxiety. I can click on those and I can look at them. I can say, yes, I want to do Heart 7. I want to do, I guess I probably couldn't do CV17, right? Because I'm doing them face down with all the bladder points, but I can add Heart 7. Again, my choice of points would be based on whether I was face up or face down, but I can simply add those to the treatment plan and I have them back in the graph. So back to my steps. My step 1 was balance the graph. My step 2 was treat symptoms. You choose what your patient is most suffering from that day and add those points. In my experience with anxiety specifically, there needs to be more than just what you do on the table with the patient. There needs to be more than just balancing the body and treating the symptoms. Oftentimes, my treatment to this treat the symptoms, one of my choices for treatment 2 is to treat the ear for anxiety, because after I treat the ear, I can, after I treat the ear, I can leave pellets on the ear and the patient can have treatment from home. So the treatment continues to move forward. And then I think that an herbal formula is really important. Are we doing okay? Do we have any questions? I haven't been peeking at questions.
Actually, yeah, Kimberly, there are a few questions down there, and I see T. Roy Jarrett raising his hand.
Okay.
So why don't we, since your hand's up, why don't you go ahead, Roy, tell us what's on your mind, and then let's look at the text questions.
Okay, am I unmuted? Can you hear me?
Yeah, we hear you.
Hey there. 2 questions, Kimberly. One, you were talking about energy flow, and you said when the energy was stuck, were you speaking of it because the one you referenced, it was actually split within the pair. So when you're saying the energy stuck, between pairs or between groups of pairs, or does it matter? Just a big drop between one to the other?
You know, in that analysis, I'm gonna share my screen again. In that particular analysis, I think it was the older, it was the first time the patient came in. So that was pretty broken graph, right? There are lots of ways that you could look at that. You could look at it, let's look at the yin-yang pairs. So here's yin-yang pairs. Heart and kidney are imbalanced here. So that is a pair where they're imbalanced. You could look at it by element. And now you've got spleen and stomach that are imbalanced. You've got kidney and bladder that are imbalanced. You've got lung and large intestine that are imbalanced. So depending on how you are treating, there's lots of advanced levels. So yes, there's an imbalance between the two. What I was speaking about just in this particular example, I was showing how you could look at the energy cycle. And when you're looking at a roadmap that goes through the body, if there's a traffic jam in the lung, of course the large intestine isn't going to get what it needs, nor the stomach. If there's a traffic jam at spleen, heart, small intestine, bladder, there's a lot of work that I need to do here in order for this kidney channel to rise. So that's what I was speaking about there. But you're correct on all accounts. I was just giving one view through energy cycle, but it just depends on how you want to look at that graph. Does that answer your question?
It does. And quickly, in the previous patient you were talking about where you were doing bladder points, but I think he had a conception vessel, one conception vessel points. Often I'll leave my needles in for 20 minutes if they're on one side. If there's just 1 or 2 points on the other side, a lot of times I would just go in and acupuncture that point, stimulate the point, and pull out. Do you ever do that and see a benefit or maybe a contraindication to doing that?
I don't see a contraindication. In my clinic, again, it depends on how everybody runs their clinic, but I have a new patient coming in every half hour all day long. So I have to go, and I have 3 treatment rooms and then another adjunct room that I use on occasion. So I'm jumping from room to room, but I just came up with an idea, and it's not a new idea. I have done this before. If I'm going to treat the patient face down and there's some points that I really want on the front of the body to help, first of all, you've heard me talk about Jade Vitality over and over. I know that when I put their belly down on the table, that the Jade Vitality is helping me out. So that's one. Or if I'm laying them on their back, I know that the Jade Vitality is helping me out from the other side. But if you put a tack on the point that you want to stimulate and then lay them one direction, you're going to get the whole package, and you're going to keep it concise in a timely treatment. So that's one answer to your question. The other part that you asked about how long, and did you ask how long? Maybe you didn't.
Somebody did on a text, so you might as well address it.
Okay. So for me, one of the most common questions that I get when people are asking me how I treat, well, if you're doing your root treatment, that's balancing the graph, right? That's my root treatment. If you're doing your root treatment, how long do you leave the needles before you put needles in for your branch treatment? It's boom, boom. I'm treating the root points first. Those are the first points that I put into the body. Then I add whatever other points I'm adding to the body, and I walk out of the room and I leave the patient. My goal is to walk in the room, graph the patient, walk out so they can get undressed, come back, get needles in, and leave the room so that I can be in the next room within a 30-minute time frame. And then when I get the next one going, before I start the next treatment room, I need to jump back in, pull needles, and say, go see my receptionist and I'll see you next week. So I would say that patients lay on the table with their needles for about 20 to 25 minutes. If they really need to lay there longer, I will leave them until I get into the next treatment room to graft someone. After I graft them and pop out while that person's getting dressed, then I'll pop over, pull needles, and keep the flow going. But I'm pretty busy. That's just kind of how I keep it going. I wouldn't have time to treat patients one direction and then the other. I might change weeks, one up, one down, depending on what their needs are. Anything else I should be addressing right now, Adrian?
Well, there's just kind of some various topics questions. So
should we catch those? Do you want to copy those down and we'll catch those at the end?
Yeah, that's fine. You can finish your presentation and then we'll kind of hit all these questions that have been coming in.
All right, maybe you could just like copy them so we don't lose them and put them someplace, and then we'll come back to them. I'll stay on subject just for now, and then we'll jump back. Does that sound good to everyone? All right. All right, so back to here, I'll just recap. We're looking at treating the symptom. So I balanced the graph. That's where 80% of my work. If I were in anxiety, if I were to use my branch treatment as using the ear, then I'm leaving ear pellets on my patient. So when they leave and go home, they have a way to stimulate those points. And that's important with anxiety. You want to give them tools and resources so that they can treat themselves in between time and they feel empowered. And then you need an herbal formula. And I don't teach herbs on here very often because herbs are based on a TCM pattern. But in this case, I went through all of the herbs that AcuGraph has. And if I were choosing, well, I'll get there in a second. Let me tell you first how to go in and look into your AcuHerbs. When you are in your AcuGraph, here's steps 1, 2, 3, and 4. Click on the reference section, then click on the herbs tab, and then you have 5 choices here. Are you going to look at the fire herbs, the earth herbs, the metal, the water, or the wood? And then 4th is once you're clicked on one of these, then you can look at each of the formulas and you can read about them. Let me show you how that looks. So if I am in a graph, or I can be anywhere, if I click on the reference section and I click on herbs, and I've got fire, earth, metal, water, wood. So while we're in wood, I can look at each of these different formulas and compare them. So I want to be clear that right now, I'm not teaching you how to look at your graph and then there's another way to look at herbs. If you're in your graph and you look at herbs here, these are herbal recommendations based on the graph. So I want to be clear that I came in from a different direction. I went to the reference section. I went to herbs. I looked at all the formulas and I chose some formulas based on the TCM patterns that I'm about to talk about. So I hope that makes sense. It's a little more advanced, but I think it's important to for this subject. So back in our other slide where we talked about, remember, let's go back and look, when we talked about excess versus deficiency, so stagnation and heart fire versus qi deficiency, blood deficiency, and yin deficiency. Let's go back. So we're going to talk about stagnation for a moment. And when there's stagnation in a pathway, it usually starts with liver qi stagnation. And then from liver qi stagnation, we get liver yang rising. And then from there, we get phlegm because that qi stagnation with the yang rising and the heat turns into phlegm. And then we get into fire. And then, so anxiety on those levels, you may have, when you're having the extreme anxiety with night terrors, you need to understand the patterns a little bit. And so I've chosen 2 formulas based on, through AcuGraph. One is in the liver section and it's number 4, and one is in the spleen section that's number 5. And if you go to the wood, which is the liver, and did I do this right? Liver. Hold on, I have notes sitting over here. Give me a second. I might have changed this.
You're allowed latitude to look it up.
I know, Shao Chai Hu Pian.
While you're doing that, I'll just post a funny meme.
Okay, so this should be 002. This should be 002 right here. And I'll just bring my notes over. So I'm going to change my number right here, 002. So the formula for 002, it clears heat, transforms phlegm, harmonizes the middle burner. So if you're looking with liver qi stagnation, with liver yang rising, and the heart phlegm stagnation, that is a good formula. And the way you find that, again, is you'll go to wood and you'll go to 002, and here you can read about it and you can read about the symptoms. It's important to understand the symptoms properly if you are doing herbs. Then for heart fire, I chose, the symptoms for the heart fire were liver fire, stomach fire, and heart phlegm. And those symptoms for stagnation and palpitations, if they also have the stomach fire and the liver fire to go with it, I chose, based on AcuGraph, I chose spleen 005. And this supports the qi, invigorates the spleen, regulates the stomach. It works with qi stagnation, phlegm damp, gastritis, and ulcers. So this formula would fit better for that patient with anxiety. And now we're going to move on to deficiency. So the deficiency patient can still have anxiety. So we're looking at anxiety in many different ranges. For the deficiency, we're looking at a couple of different reasons. The first reason would be qi and blood deficiency. And then the second reason would be an extension of that. If you, beyond qi and blood deficiency, if they also had yin deficiency. And so the formulas that I chose based off of what AcuGraph has to offer were the spleen 002, Shirkwan Dabutan. It's great tonifying. So it's for qi and blood deficiency, and it also strengthens the wei qi. So it's going to strengthen their immune system. But by strengthening their qi and blood, then you're going to help them with anxiety. And then the other was qi, blood, and yin. And if you went to the heart 001, this replenishes qi, nourishes the blood, tonifies yin, clears heat, and calms the shen. Again, the way you can read about each of those is in AcuGraph, and you can read about the symptoms. So as you can see, I'm using a sandwich approach. I am not just graphing the patient. I'm not just treating the ear. I'm not just giving herbs. I'm using all of the pieces because that's how you're going to get better results. You got to get beyond the 80%. You need to be really good at it. And AcuGraph gives you a few clues when you are by analyzing the graph. The next thing that I want to talk about are tools and resources. I'll just go ahead and finish my presentation and then we'll jump into questions. So there's a blog post that I wrote. Adrian, do you remember this one? Kimberly came to work angry. This is back, we were working on auriculo, I don't know how many years back. I was in a different office at that time. And we were playing with the Stim Plus, and we said, let's find how many angry points there are in auriculo 3D, and we found all the points related to anger, and every one of them were active on me. And so that blog post, it's called Kimberly Came to Work Angry, and I'm going to teach you how you can find that in your AcuGraph. You go to Home, and you go to, where's the blog? AcuGraph News, which will open the blog post, and then Kimberly angry, and Kimberly came to work angry. And then you can go and read that blog post. It'll be interesting. It's a nice analysis based on auriculotherapy. And all of those anger points are right here. If you open up your auriculo 3D and you put in the word angry, these points all come up. And we were using the Stim Plus Pro, and we were searching to see which ones were active. And they were all active on me that day. Another really interesting case study and kind of a sad, heartwarming story. I wrote a blog post called Mending a Broken Heart. And this was a woman who, it was deficiency in the heart and pericardium. And when I asked her questions, I found out a story that was going on in her life. And I talk about how I analyzed the graph, how I looked at the internal pathways, how I understood what was going on based on AcuGraph, and then the special treatment that I gave her that day. So that is an interesting blog post for you to read. And finally, dun, 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 dun. Everyone give me a thumbs up if you're super excited to hear the next part. We created another patient education video for you. And I don't want to tell you yet. I'm going to put it in in the chat window. Here's how we want you to do this. We have found that when I try to show a video through Zoom, it's all choppy and it's hesitant. So I am going to post the link, and we want everyone to click on it, open up another screen, and spend 3 minutes watching the patient education video, and then you can pop back over. And whoops, hold on.
Anxiety. It's a hard reality for so many
no.
people right now.
I didn't want you to hear
in
it
our
yet.
modern world. And
okay, hold on. Here's the link. There it is. And we're going to give you 3 minutes to go over and watch it and then come back. Are we done? All right, I'm expecting people are going to be popping back over. So what do you think? Thumbs up? Thumbs up? Do you feel like this is a great resource to share with your patients? It's pretty exciting. Adrian's giving 2 thumbs up. Yeah, we're having a lot of fun creating patient education videos. AcuGraph is the most amazing patient education tool. If you can show your patients on a screen how you can help them, and you can plant those seeds out into the world, all of us will be better in our practices. They don't have to think completely and as extreme as you do. You just have to have a way to teach them that you can help them. And they just sit there and they're so grateful, right? Do you get this experience on a regular basis with patients in your clinic? This happens regularly, and I'm having a lot of fun with the patient education videos.
I want to add too that we make these so that you can use these with your patients. You're all free to link to these things, link to them on your site, your newsletters, whatever, and share and teach people about acupuncture.
Fantastic. So I think I got a a little bit of closing, but I'm not going to go there yet. Let's get into the questions.
Do you want me to start firing them at you, Kimberly?
Yes, please.
Okay. So the first one was just a brief one. Well, it wasn't the first one, but how long are you keeping needles to balance the chart? You kind of already addressed that.
Mm-hmm.
Somebody said, can you show the auriculotherapy option? But then you did. Kimberly, hi. Do we expect to see alterations on the pericardium first before it affects the heart? On the ground.
Not necessarily. I feel like they just kind of work together. I don't have a better answer. I haven't ever noticed that correlation. Sorry.
That's a good enough answer. That's okay. Let's see. Somebody says, regarding split skin on fingers behind or slightly under the nail end, beyond which meridian, and then it trails off. So I'm not sure what the what the question was going at. Sheila, could you jump in and clarify for us what you're asking about split skin at the end of the
Actually, can you hear me?
Yeah, go ahead.
Oh, hi. Thank you for answering this. So this happens actually to me, and I'd heard that it was actually a lack of a mineral, but I couldn't figure out which one. I can show you if you want to see it. Can you see there the split?
Oh, yeah.
And now it's not just me, and I don't think it's also age related. It happens to a number of my patients in a big age range. It's not always on the thumb. It does tend to happen more in winter, but not always. And so I do look at the meridian, but I don't know if it's just specifically related to that meridian or not. And I'm not quite sure what I can do about that. I've read, I've looked, and I'm still clueless. So if you have any opinions or suggestions, I'd be more than happy to hear them.
I would bet that there might be somebody in here who specializes in autoimmune. That sounds like an autoimmune type of something.
I can tell you it really hurts. It's very painful. You don't want to bang it.
I will add, by the way, that those are so hard to keep protected. And something I found that for me was an incredible help for that sort of thing, because in the winter, I tend to get that at the nail corners, is, I don't know if you can see that, it says liquid bandage.
Liquid bandage, okay.
And it's got an antiseptic in it, but it's like, it reminds me of clear nail polish. You just paint it on, it hardens, and it is amazing because it keeps it sealed and protected, and it heals, and it keeps it disinfected. So that's not preventative, but it may help.
I've been dropping lavender essential oil in it.
Okay.
And then when I work with patients, I'm always wearing a glove. I'm allergic to latex, so I can't do finger cuts.
Okay.
Yeah.
But
Adrian, does that burn when you put it on?
The lavender?
No, I was the bandage.
The liquid bandage. Briefly.
Okay.
Briefly, it does, but then once it kind of dries over, it makes a very nice, long-lasting, like several days worth of protection.
Ooh. Okay.
I think I tried that once. I remembered the burning, and then if you have to keep putting layers on it so you don't have to go back to the burning again. Just keep that layer on there.
So yeah, there's something to chime in there. Go ahead.
I'd like to come in on this conversation because I'm a practicing psychiatrist as well as acupuncturist. Have noticed immense amount of anxiety people are experiencing because of separation and loneliness. Now, there's a practice that I'd like to share. It only takes a couple of minutes to do, that you could get your patients to do, which will help diminish their anxiety, but it'll also complement their acupuncture treatment. So they could do it post the treatment, they could do it during the treatment if the needles aren't going to be bumped out.
Sorry about that. Somebody unmuted. Go ahead.
That's all right. The technique is called havening, and there are a couple of good YouTube links on it. There's an anaesthetist talking about how it's done, and he gives a 20-minute demonstration of it. And there is also a YouTube video describing the neurobiology behind it. And it's wonderful. It's complementary to a lot of this stuff you've been talking about, anxiety. So I'm going to give you the rocket quick version of it if it's okay. It'll only take a couple of minutes and I'll just show you what the steps are. People can go home and practice, and I'm happy to come back at another time and do a session around this and a whole bunch of other things to share with you guys if you're interested.
Yeah,
So,
go ahead with the short one.
So the way this havening technique is done is it involves going this. Well, I usually ask people, out of 10, where's your anxiety before the session? And then we start like this, just moving from one side to the other. I get them to do that first in the same pace as their breath. And you can increase the intensity of this by lifting your tongue to the roof of your mouth on the in-breath and dropping it to the floor of your mouth on the out-breath. And so I usually get them to do about 8 of those to begin with. And then the next part of this is you go to the shoulders, and the out-breath goes down to the elbows, and the in-breath comes up to the shoulders. So I do the first part of the movement, and then I remind them about the tongue. Lift the tongue to the roof of the mouth on the in-breath, drop it to the floor of the mouth on the out-breath. They'll often describe saying they feel a bit drowsy, and then you say, that's fine. That's just the kind of rest that you need to have to help your body rebalance itself internally. Now, the final part of this is some people like putting their hands over their face and coming up round the side like that. I found other people just like to have their hands put on their face. However, if you've got people that are trauma sensitive, you might have to be careful with that. I have other people that just like to stroke their thighs in pacing with their breathing and doing that tongue movement. Then you ask them at the end, where has your anxiety gone now? And usually 8 or 9 times out of 10, it goes down. I encourage people to practice that 4 or 5 times a day. Do it at a time when you're not anxious, so that when you are anxious, it becomes an even more powerful tool.
Thank you. I'm going to look that up.
Thank you. Yeah, so that's havening.
Havening.
Videos. Okay.
Yep.
Thank you for sharing that.
So
Could
what
you
I will
spell
be doing is I want to make a YouTube video on it, and I'll link it to you guys, and I'd like to tie it in with some of this Chinese medicine stuff because it's all complementary to it. But the reason it's so powerful, it has a strong neurobiology shift that it brings about, but it also helps. One of the big things about people social distancing is the loss of attachments and loss of feeling insecure. Doing this stuff helps soothe that. It drops the anxiety level down.
Great. Thank you. I saw that Guy had his hand raised for a question, but then it went back down. So, Guy, if you're still with us, feel free to pop in and ask your question or make your comment.
Yeah, I was going to make a comment on the skin condition, being that's the thumb, you're looking at the lung channel, so lung and skin are connected. I've done a lot of work with homeopathy. Your tissue salt silica is one of your main minerals because it organizes all the other minerals. That would be a very effective. And a company called Sea Royal out of Canada, they do UNDA numbers, and the UNDA number that I had in mind was 270. And 270 is connected also to the kidney. So there could be a yin issue going on with the lung and kidney that's causing that problem.
Great. Thanks for chiming in on that, Guy.
You're welcome.
If I could also add, for Sheila, calendula, just a calendula ointment. I don't know if it's an open wound or not. but calendula is a good skin healer. So if it's an open wound, that sort of thing. So just a thought.
Thank you.
Thank you.
Guy could just repeat the mineral he said. I didn't hear him.
Maybe he could post it in the chat so we could copy it.
That'd be awesome. Thank you.
Okay, I'm going to get back to reading through the rest of these questions. There's a lot coming in, Kimberly, so let's keep
Okay.
moving here.
I'll let you be in charge of questions.
Yeah, you got it. Let's see. Would you balance first, remove needles, and then add step 2, or do you always combine SX points? I think that meant TX points, treatment points, while doing the balance points. Oh, SX, symptoms points, while doing the balance points.
Yes, I think I talked about that just a little bit ago. It's all one flow. I put the balancing points and then I add the symptom points.
Okay, and then Robin says, I'm interested in understanding how you compute the PI score. You know, I think we did a webinar on this, and you can access that in our webinars section in your AcuGraph account. I'll give you just the 30-second answer because the full answer gets quite involved, but the quick answer is this. It's a statistical model that we developed by analyzing a couple 100,000 graphs, and it involves looking at the number of imbalances, the type of imbalances, the severity of imbalance, and then yin versus yang, left versus right, upper versus lower, all of the different things, all of the different factors that we look at in balance. It combines them all into a statistical model that weights them all appropriately and comes up with an overall balance score. And it, of course, also takes into account age, gender, and the areas of imbalance. So it's quite complex. We actually filed for and got a patent on it because it was rather innovative. But that's the brief answer. And the briefer answer is it reflects overall balance. So hopefully that's helpful. Maybe we can get a link up for that webinar about the PI scores.
I got the title, and you can.
Oh, okay.
You get there from your dashboard. I can show you that when I share my screen again.
Okay. Okay, great. All right. Andrea says, do you take insurance? I'm wondering how that flow would work with sets of needles if noting and billing for insurance.
I don't have any insurance information for you. Sorry.
And that's not a bad place to be. If you can practice that way, it eliminates so many headaches. Let's see, we have a question. Do you use electric on the needle?
Sometimes.
And I can attest to that. When Kimberly's treated me, she at times hooks up the electric stim and gives me the little zap, and very helpful. Thank you. What about TCM theory about keeping needles at least around 30 minutes?
I think there's so many theories that you get to choose what you want. You have theories that say go deep. You have theories that say just touch the skin. You have theories that say never treat a heart point. You really get to do what you want.
No problem. Okay, let's see, Heidi says with a HA and PC deficient, I think meaning heart and pericardium deficient, I'm asking about their sleeping. And that's a great point, Heidi. Certainly.
So my subject in January is going to be insomnia, but they will have sleep disorders, and it comes back to the heart shen, and so you want to think of the underlying pattern, heart chi deficiency. It can be anxiety. These same issues that we're talking about for anxiety in the heart, you could think the same direction for insomnia. I'll have more on that in a hangout soon.
Okay. Alok asks, where do you get these herbs? Do these imports need license, or it's free to import? Let me just point out that the herbs that Kimberly was talking about today that are used in AcuHerb, these are the patent formulas that have been around for hundreds or even thousands of years. and they're available from a variety of herbal suppliers. All the major suppliers will have the patent formulas. So you don't have to try to import them from us. If you can get them in your own country from your usual herb supplier, just get that formula. He also asks, if lung has stagnation, as you show in the graph, which herb can be given and how do you decide which herb to be given?
I kind of talked about that with the examples that I gave, and you'll have to go into AcuGraph, into the herbal section, and pick and choose according to your TCM knowledge. I gave examples based on stagnation and versus deficiency, and talked about the symptoms related, and that's probably the extent of what I could really teach in herbs under this circumstance.
Yeah. Yeah, the full answer is a course of several years.
Yeah, the master's degree in Chinese medicine with herbal, it's above my head. I studied it all, but I won't claim to be the master herbologist.
So how many sessions do you usually treat for this condition?
I'm actually in the process of developing an anxiety package, and I would say 5 to 6 treatments. The key is understanding what that underlying pattern is and getting them on the right herbal formula. And then I also do other things, like I teach meditation techniques and other ways that they can help to deal with their anxiety. And I didn't expand into that in this webinar.
Okay. Great video, Rajiv says, given the COVID environment, how do you put yourself and patient safe and the anxiety low? I think, in other words, how do you put them at ease regarding COVID and environment and safety in your clinic?
Our clinic is very clean. We have large treatment rooms. We have an easy 6-foot distancing. We don't have patients coming in at the same time. They come in, they go directly to their treatment room, and we have multiple treatment rooms and all the cleanliness. We just do the best that we can. I have made it very clear that we are a safe place to come, and we are essential. And I want my patients to know that, and that I'm doing my best to live my life to keep myself clean and clear so that I can take care of them. So that's the best that I can do.
Here's a question. This is probably too broad to handle in a comment, but please suggest for hormone balance for females.
That is a whole nother big, huge subject. I would have to have a whole balance the graph and then treat the symptoms. That's the simple answer.
Okay. Okay, great. That brings us up current, Kimberly. So please give us your big conclusion.
Okay, this is fun. Are you guys having fun? I am having a lot of fun. I lost my slides.
The grand finale.
There it is. Okay, so in your comments, we gave you the link. Maybe you could post that one more time, Adrian. It's right here, but we want you to have the link so that you can share the video in your clinic. You will get an email with the link, and you're going to get a blog post from me fairly soon on anxiety. And our whole purpose of making sure you have patient education information is we want to spread the word. We want our acupuncturists to be successful. And so we're doing our best to help you in that way. And our videos will tie people back to the fact that you use AcuGraph. And it will, anyway, take the link, share it, share it, share it. And when you're over there watching it, if you would do us a favor and go and click like, maybe make a comment, and then make sure that you're following Meridia Technology on YouTube so that you get notifications when we create more videos. That would help us greatly. Cool. Then, Until next time, and I want you to recognize that you are essential, that your patients need you, and really, perhaps now more than ever. So as you have the tools and the resources to help with anxiety, that is, you're helping to change the world, and I'm excited to be part of that journey with you. Here's a little bit of something that you should be looking forward to. Adrian, do you want to talk about this? Or do you want me to?
I'll say a couple words and then you fill in. We've got this course that we put together, innovative stuff that Kimberly's been doing with fibromyalgia. It's wonderful. And there's a link here in the comments section where you can jump in and take this. You get CE credits with it. It's free. Why don't you take what's given freely? I think you'll really like it. Fibromyalgia, as you know, is a huge problem, and acupuncture and related techniques can make a big difference. What can you add, Kimberly?
I would like to say that when I did my doctorate program, I finished that last year, I chose a few key subjects to focus all of my energy on. If I was going to write a paper, I wanted to write a paper on something that was meaningful to me and in my clinic, and perhaps something that I could share back with the Meridia technology, all of you people who use AcuGraph. And fibromyalgia is a passion of mine. I've been treating it for 25 years. And as a massage therapist, before I was an acupuncturist, people with fibromyalgia would just always show up at my clinic, and I got really good at treating fibromyalgia. Then I moved on and had acupuncture, and I got better at treating fibromyalgia. And then I realized that AcuGraph is the perfect fibromyalgia patient education tool. And then when I was in the doctorate program, my doctorate was on becoming a bridge to Western medical practitioners. We as acupuncturists, if we can use our language of what we do and be able to talk to Western medical doctors in a way that they understand, we don't need to force TCM down their throats. We need to help them to understand that we understand their medicine. Fibromyalgia is a missing link in Western medicine. Fibromyalgia is acupuncture is a wonderful resource for fibromyalgia. And if we can train the Western medical doctors that we can help them to help their patients, they are so grateful to us and they send referrals. And so I talk about in this course how I do that with AcuGraph, a report of findings, resources, all things that I had to do while I was in the doctorate program. And so I share that with you, and it's one of my, I will just have to say, it's a great course. I had a lot of fun creating it. So that's the background.
Very cool. Any other slides? Kimberly, or I see Kara put up a link for the Revitalize package.
I'm going there. There you go.
Okay.
You want to talk?
Just to say these tools are very helpful. These are some of our most proven things that have shown to be not only popular, but really beneficial to patients and at a great package price. So sale goes through November 1st. Check them out. And there's the link in the comments. So thanks everybody for your comments and questions. There was one more that somebody wanted to sneak in just under the wire.
Okay.
Kimberly, do you have any statistics on the effectiveness of acupuncture on high anxiety, or from personal experience?
I tend to ask the patient where they're feeling anxiety in their body, because I want them to know what they're feeling in their body. So when they leave, they're aware. I'm always teaching them how to feel things in their body. So when they come in and they're feeling anxious, I ask them, where are you feeling this? And what's happening in your body? Where do you feel stuck? And what are the emotions that you're feeling? And then I treat them. And sometimes it's just a few simple points. And then I ask them, now take a deep breath and tell me what you're feeling now. And everything shifts. And Do I have numbers and statistics? I just know that acupuncture is very, very, very effective for anxiety, and it's used not a protocols. It's used for drug rehab and all the emotions regarding drugs. It's used for anxiety during pregnancy. It's good. It's wonderful. I don't have a number, but if you went and started looking at statistical analysis and PubMed, you'll find all kinds of resources that tie back to acupuncture, and a lot with auricular therapy.
Right. Well, with that, we're going to call it a close. Thank you, everybody. Seriously, we really appreciate you taking time to be together with us. Thank you for the comments and questions. A big thank you for Kimberly. I feel like we should all applaud. She put so much time and heart and love and energy into these presentations because she really does care. She wants to make this the best she possibly can for you. And I just want to acknowledge her and all the great work she's doing. So thank you, Kimberly.
You're welcome.
Everyone
Hey,
else.
everyone, real quick, if you'll mark your calendar for November 13th, Friday, November 13th, our subject is going to be chronic pain. And if I love anxiety and I love fibromyalgia, I absolutely love chronic pain. So I'm excited to take you down that journey next.
Thank you.
You're welcome.
Okay. Goodbye, everybody. Thank you.